Namaskar, hello and a very warm welcome viewers. You're watching our special series, Corona Samvad on COVID-19 management. The countrywide vaccination drive was rolled out in January last year. Prime Minister Narendra Modi announced on December 25th that India would begin administering precautionary doses to those above the age of 60 and suffering from comorbidities from January 10th. COVID-19 vaccination for adolescents in the age group of 15 to 18 years commenced from January 3rd. For this gigantic task, there is COVID platform, which has been providing an effective rollout for scaling up the mechanism of the COVID-19 vaccine distribution system. And joining us today is a very special guest on Corona Samvad, Chief of COVID Platform and CEO of the National Health Authority, Dr. Sevak Sharma. Sir, welcome to Sansad TV and thank you so much for joining us.
Thank you very much for having me on Sansad TV. I want to sort of convey my best wishes for all your viewers.
Thank you so much, sir. And as we know that India's vaccination drive outpaced most countries as it breached 1 billion inoculation mark in October last year, we're achieving new milestones with each passing day. How have you ramped up the capacity of the servers and other parameters to match the unprecedented scale of immunization?
Well, thank you very much, Kriti, for that question. I think it's a very important question. Because when we designed COVID, we were aware that India is a country of 1.3 billion people. And we are going to have a system which will cater to billions of transactions. And also in a day itself, we are going to have, let's say, 10 million plus transactions, which will mean about 1,000 transactions per second. So I think from the beginning itself, we designed COVID to be an interoperable platform, to be a platform which was scalable, and to be a platform which basically provided services to large number of people in a diverse condition. And therefore, the platform has got to be inclusive also. So these were some of the considerations, overarching considerations, which actually went into designing this platform.
All right, sir. So what are the provisions and the changes that have been made on the digital platform to include the new category of beneficiaries?
Very good question again. You see, when we designed the platform and when we started operating, and in fact, it has been just about a year, on 16th of January 2021, the Honorable Prime Minister launched this world's largest vaccination program. And at that time, the people who were covered under this program were the healthcare workers. Later on, the frontline workers were covered. Later on, 60 years plus were covered, then 45 years to 60 with comorbidity, then 45 years, and finally 18 years. And now we have children and also the precaution dose for 60. So there have been multiple changes which have continued to happen. And the way we have designed the system again is that the changes are merely external rules which actually we plug into the platform, which means that we do not have to do any code changes as such. We just plug in a new rule file, which essentially guides the entire vaccination program. So that way we have made this platform very, very, easy to change rules and to, cater to the changing rules and policies of the government.
So COVID now has a feature which allows anyone to check a person's vaccination status with the latter's consent. What's the feedback on this feature? How instrumental has this been?
Actually, the more important point was that we need to instill a sense of confidence and also a sense of pride in the person who has taken both doses of vaccination. So we thought of an idea that why can't a person, flaunt their vaccination status to the world, saying that, look, I am vaccinated, are you? So in a way, vaccination becomes a token of pride. So that is the thought with which we started. We also started this with the provision that if any company or any private, company or any other office, if they want to give incentives to their employees or their, for example, railways want to give some incentive for people who are fully vaccinated, they can do so. So when you are booking a ticket on railways, you can just plug in your vaccination status, share with them with your consent, and probably get some discounts or some kind of coupons. So this is the idea behind this program, and I think it has been quite successful and uptake has been quite good.
All right, sir, before we talk about other features of COVID, the United Health Interface, an open and interoperable IT network for digital health in India, is going live. You have said that UHI has the potential to transform India's health ecosystem. What would it mean for the people of this country?
Well, again, that's a very good question. Actually, UHI has become live only this week itself is going to become live, in fact. And what it means is it's called Unified Health Interface, similar to the payment ecosystem, which is Unified Payment Interface. And the whole idea is that we should be able to provide an ecosystem where the providers on the one side and the clients or the consumers on the other side will be able to connect to each other and discover for example, the consumers can discover the providers, then they can book the services and they can avail the services. So essentially discover, book and avail. That is going to be the policy, the philosophy. And we are going to connect as many services as are possible to connect through a common platform, through a common network. And when I say UHI is in a way is a language of availing the health services, language for health services delivery system in some sense, like UPI is a language for financial money transfer system. So that is the way it has been architected, and I'm sure it will be as transformational for health services delivery as UPI has been transformational for payment services delivery.
So if I have to use that service, what would it mean for me? How do I ready myself for it?
No, the idea is that on the one side, there will be all service providers who will, one by one join the UHI network. And on the other side, there will be consumer applications who will basically be joining who will basically be coming on to this platform or this network. And what it means is that now you'll be able to, let's say, book an ambulance, look for doctors, do a teleconsultation, do a medicine purchase, and stuff like that. The whole idea is how do you leverage the digital communication systems to basically get and provide affordable, accessible, and quality health services to our people.
All right, sir, you're talking about digital interventions. Let's contrast the two situations. Now, manually run mass inoculation drives in the past, polio and smallpox being cases in point, reached the rural poor the last. Contrary to this, COVID enables data collection that supports close to real-time development, implementation and evaluation of India's response to fast-evolving pandemic. How has COVID platform leveraged all these evolving and developing applications?
I think, what is very important is that we, through COVID, have been able to bring all the providers and all the consumers on a single platform, which means that everybody who is providing vaccination services is on COVID platform. Thereby, they publish their timetables as to which vaccine they are offering, what is the price of their vaccine in case it's a private service provider, what is the number of seats they have, number of slots they have, what are the timings of their hospital or the vaccination center opening, etc., etc. These are minimal information which they publish. It's like publication of a railway timetable. Once you publish the timetable, there are consumers on the other side who are basically looking for which is the hospital nearby me who can provide this vaccine. I want to have this vaccine free of cost or at this price. So that's another part. Third is, because we have the data of every vaccine done, we can also proactively message the people saying that, look, your vaccination second dose has become due on this date, because we know as to which vaccine he or she has taken and when is that, when the normal period either of 28 days or 16 weeks is expiring, and then we can give him the message. So that is the way the platform is operating. Compared to this, the immunization program does not have a single source of truth as of now. So what we are thinking and what we are doing now is repurposing the COVID platform to provide for immunization stuff also, so that every child will have a record on the similar to COVID platform or the immunization platform, let's call it, on that platform, so that we will be able to remind the guardian of every child that your polio drop, the second polio drop has become due on this date. And then also the ASHA worker who is working and who is basically delivering these drops will be able to see on that platform that yes, these are the children who are become due for second dose, and she can contact them and go. So therefore, this information system will benefit all these stakeholders, whether they are providers or whether they are consumers or whether they are people who are delivering these services. So this is, I think, this paradigm of COVID is going to be replicated on a number of other platforms which are of the similar nature.
All right, sir, that's a very important piece of information that you're sharing with us. And since you're talking about replica, we know that Prime Minister has been a strong advocate and promoter of open source, having recognized how it can help bridge the digital divide. We also know that several countries expressed interest in adapting COVID to vaccinate their citizens. What's the latest on that front, sir?
Well, as you know, the Prime Minister had launched a COVID Global Conclave on 5th of July.
Yes, sir.
And more than 140 countries participated in that conclave. Thereafter, there have been interest shown to the Ministry of External Affairs by many of these countries to basically adopt the COVID system. We have also at our end made the COVID system as an open source system. And also, the code base is open. We have trained people, we have prepared documentation, and we have trained people to install this software. So I think from our side, we are ready from a technical standpoint. Now the Ministry of External Affairs is carrying out negotiations and carrying out discussions with those countries. My information is that as many as 12 countries are on the verge of signing of the MOU. And there will be MOUs, in fact, from some of MOUs will be signed in near future. That's my information. But ultimately, it is for the Ministry of External Affairs to deal with this subject. We will only be able to provide the technology assistance and the source code and the other kinds of technology-related assistance to those countries.
Right, sir. But I also recall that COVID was attacked for want of a privacy policy for collecting personal data and possible use of facial authentication in the future. But till now, there has been no breach in the application. Do you think that those concerns are completely allayed now?
No, the point is that, the COVID basically collects information relating to your identity, which means, information such as Aadhaar number or the driving license or the passport. Because ultimately, when you go to a vaccination center, ultimately you have to identify that you are you, right? That's a minimum thing which you are supposed to do. So that's one thing which we collect. And secondly, we collect the name, gender, and age. That's all, year of birth, in fact. So therefore, the minimal data is collected by COVID. And once you have the minimal data collection policy, then to that extent, the danger reduces. However, it does not mean that the data is up for sale or up available. We have a very strict data protection and privacy policy in place, which ensures that this information is completely safe and secure with our system. So there has been absolutely no breach. There were some rumors or some kind of news floated by the media, in the media, not by the media, in the media that the 15 data for 150 million Indians were available for sale in dark web, which ultimately turned out to be false. So there has been no breach of any data from the privacy perspective or security perspective.
Absolutely, sir. Sir, you've also underscored the need for public-private partnership for ensuring a robust healthcare system. What is the way ahead, sir?
You see, healthcare is essentially delivered by multiple stakeholders to the people. So a major portion of, let's say, the OPD-related stuff or the tertiary care or the secondary care, while it is delivered by public healthcare system, it is also delivered by the private health service providers. So I think what is important is to realize and recognize that the roles of the public and private partners are complementary.
Yes.
It is not, they are not competing with each other. And therefore, I think the best policy is to leverage the role and recognize and leverage the role of both these providers. And that is what we precisely want to do. In the Ayushman Bharat PMJY, we have about 24,000 empaneled hospitals, half of which are public and half of which are private. So private hospitals are also, and they are actually delivering more than 50% inpatient services to the people. So therefore, the private-public partnership in PMJY, private-public partnership in ABDM, Ayushman Bharat Digital Mission. So that is the policy and that is the philosophy which we follow in the National Health Authority. And I think overall also the National Health Policy of 2017 also emphasizes that fact.
But sir, the current bottleneck is the digitization of health records.
Yeah, you are absolutely right. This is the initial thing where it becomes very difficult. But that is a challenge which has happened in almost all sectors. Imagine the cash economy. So people were transacting, people were paying cash, and then the digital systems came, the UPI enabled applications came, and last month we transacted more than 4.5 billion transactions in a month, which is actually 450 crore, which means about 15 crore transactions per day, which is a huge number. Now people are now even paying grocery wala, thela wala through the digital means. So essentially, it does take time to convert, to basically develop an ecosystem of digital kind of health records. In any sector, it is there, but in health, it is more difficult because Dr. Saab will write prescription and he feels it very convenient, and rightly so, in writing on a piece of paper. Then, but now there are tools and technology which are available. The patients are also now probably going to demand and use the digital records. So this way, I think we are going to set in motion a virtuous cycle of having the digital records. So, for example, laboratory test records, they will all become digital, and that they will be the first records to become digital. And thereafter, I think we will proceed in that direction.
All right, sir. Are we looking at any specific roadmap for it or specific timelines for it?
Actually, I cannot give you a timeline in the sense that, and on day this or day that, all the records, health record will become digital. That's not really possible for me to speak at that time, but we need to create an incentive aligned system whereby every stakeholder feels that this is the right path to take.
All right, sir, before we end our conversation, your closing comments and closing remarks on COVID and India's foray to vaccinate its population.
I think India has done a great job, and the credit must go to all our field workers, all our vaccinators, doctors, nurses, everybody, administrators, and of course the Prime Minister has led it from the front. So I think that has been an extremely successful program of vaccination. No country in the world has done 160 crore kind of vaccinations, and we are doing at the rate of, and a very sustained rate of 8 to 9 million per day. Even yesterday, looking at the figures, it is more than 8 billion. So I think we have done a great job. And I must say that COVID has been a very, very good enabling platform, which has provided a very robust single source of truth and a very orderly, sort of platform for vaccination in the country. Because I don't think such a massive task would have been completed if we did not have a technology backbone which actually provided the portability, which provided the ease of entry, which is inclusive system, which could have provided such interoperable systems. We have today more than 100 partners working with COVID, which means that even a Paytm application has a COVID booking facility. So this is the way API based, open source based, and as you mentioned about the open source policy, we had a triad of policies, which is open source, open API, and open standards. And we have applied all these in development of COVID. And therefore, the APIs are published. Any partner can just kind of integrate with COVID and provide the same services of discovery of COVID vaccination centers, discovery of various vaccines, as to which vaccines are being injected where, and finally book your slots. So that is a kind of facility which has been provided, and I think that we have been very fortunate in our Prime Minister's directions, that he actually in the beginning itself he said that we have to make COVID as a world-class product, and actually we have adhered to his vision and direction, and today COVID is a world-class product.
Absolutely, sir. Tough phase for you combating this unprecedented crisis. On that note, Mr. Sharma, thank you so much for joining us and sharing your thoughts with us.
Thank you, Kriti, for having me on your platform. Thank you very much. Good night.
Well, viewers, that's all we had for you in this edition. Take care, stay safe, and stay tuned to Sansad TV. Namaskar.
लोकतंत्र